Hi, my name is Kathy Castillo. I'm a speech pathologist here at Santa Clara Valley Medical Center. This training tape is designed to assist in the early detection of potential swallowing difficulties in patients with tetraplegia. I'll briefly review premorbid conditions, factors that influence swallowing, and questions you may want to ask. And finally, you will see two patients, each with a bedside evaluation and a videofluoroscopy. You'll be able to compare and see for yourself. Let's first talk about some premorbid conditions that can affect an individual with a spinal cord injury. In general, as we get older, the muscles of the neck and throat weaken. Our bones become weaker, and arthritis can affect the bones of our spine. Simply stated, osteoarthritis can cause swallowing difficulties in the non-injured population and in the spinal cord injured population. Osteophytes at the level of C4 to C6 lie at the opening of our airway, as you see here. Food and liquid can bounce off of these bony areas and into our trach. Patients who have had radiation have a difficult time swallowing due to stiffening of the tissues and muscles. Patients who have had esophageal dilation prior to the spinal cord injury already have swallowing difficulties. A disruption in the natural flow of breathing can affect an individual's ability to safely swallow, as in COPD. Any added weight to the neck when a patient is trached can of course present additional swallowing problems. There's been little research on the following medical conditions, but we know through experience that these two can cause swallowing difficulties. What are the questions to ask prior to the swallow evaluation? Does the patient have any food allergies? Is the patient having any pain in their throat when they swallow? Have they heard their voice lately since the accident? This will give me an idea of whether there's some vocal cord damage on intubation or after surgery. Are there any difficulties swallowing prior to the accident with bread or pills? Let's talk briefly about some other factors that can influence a safe swallow. A spinal fusion, especially anterior. Was this individual orally intubated, and where? In the field or in the emergency room? Bronchoscopies, for the same reason stated above. We already know through research that any neurological damage, such as brain injury or CVAs, can negatively impact a swallow. Additionally, research is beginning to emerge tying aspiration pneumonia to OG tubes and NG tubes. Individuals who have halos or cervical collars can also be at risk for choking or aspirating due to mobility limitations. And we've already discussed the effects of aging. And finally, more objective questions I use to determine aspiration. It is key that you know the amount of secretions being suctioned from the trach. How many times in an hour? How many times per shift? What is the color and viscosity? Is it thick and yellow or thin and white? Clear and frothy? Is the individual requiring frequent oral suctioning via the Yankauer? How many times in a 15-minute period or an hour? What is the patient's vital capacity? Is it increasing or decreasing? Is the patient beginning to T-tube? What are the individual's O2 requirements? Are they increasing or decreasing? Individuals with COPD generally oxygenate at a lower level. And as stated before, patients who are obese have added difficulties swallowing. What I want you to do is take this ice chip and go ahead and let it melt. You can chew it, you can wait till it melts and go ahead and swallow, okay?
얼음 녹을 때까지요. 입에 물고 계시거나 씹어서 준비되면 이렇게 삼키세요.
So what I want you to do is look at how his larynx is not fully elevating when he swallows. Let's try one more. And comes down. Same thing. A little bit of hold up here. Okay, how does that feel?
어땠어요?
이쪽은 조금 있는 것 같고 한쪽은 넘어간 것 같고 그래요. 조금은 걸린 것 같고 나머지는 넘어간 것 같고.
It's just
Yeah.
partially
Yeah.
stuck in around the
It feels like it's partially stuck. Okay, there you go. I'm going to take the valve off and we're going to do some carbonation. Okay, there you go. And again, we're looking at its laryngeal elevation. Go ahead and swallow. And you can see it really doesn't come forward. It's just holding up. Let's try one more sip. And again, I'm looking for some laryngeal movement forward. And the other thing that I wanted to note is that in this position, he is not fully upright because this is the position he will be eating primarily. So putting him at 90 degrees is not a very functional position for him. What you're seeing here is applesauce, thin liquids, carbonation, and ice chips. Unfortunately, the ice chips and the applesauce are not videotaping very well, but he did aspirate on both consistencies. What's important to note here is on all the consistencies he aspirated on, he did not cough, and you'll see that. Also note how tight his epiglottis is up against his pharyngeal wall. And there you see some aspiration, and it's a little more dramatic on the next swallow. And there you see it. Mrs. has a C7 Asia A spinal cord injury. She was orally intubated for about 2 weeks and is now trached with a number 6 Shiley. We did a bedside earlier, a couple days ago, and followed it up with a videofluoroscopy, which you'll see in a few minutes. I'm only going to be giving her ice chips today because she did aspirate on all of the consistencies we gave her. So, what I'd like you to keep in mind when you're assessing a patient with a halo is neck extension and flexion, and making sure that the jawline is not moved too close to the spinal cord. You can't really tell too much right now, but when you see the video, you'll see why it is that she's having the swallowing difficulties she's having, and it is because of the halo. So let's start with an ice chip. Now you will see some movement in her neck. You'll see her larynx trying to elevate, but it is not really able to come forward and complete the swallow because her epiglottis is hitting the back of her throat. Okay, I'm going to hold this down a little bit so that you can get a picture of neck in this halo, and then you'll be able to compare how it looks bedside with her videofluoroscopy. And what I want you to focus on really is right here, how close her jaw is with her spine. She was given 5 different consistencies, ice chips. You can see her trying to swallow the first ice chip. She's chewing the second. And slowly starting to aspirate. She was also given carbonation. Where she immediately aspirates. Very dramatically, and you can note that she is not coughing. Thin liquids. Able to squeeze it down, but not really able to get that epiglottis down, and therefore aspirating. You can note she does not necessarily aspirate on every swallow, but accumulatively she's aspirating on all of the consistencies. This is applesauce. And again, there's no coughing on the aspiration. Thick liquid. Significant amount of aspiration.